Good evening. Welcome, welcome. I am watching the bottom of our screen while our guests file in. A big virtual welcome to you to our parental guidance episode tonight. We're so excited to have you. I'm going to do a few housekeeping things as we wait for people to join us. I'll probably give a couple minutes, but if you would utilize that chat feature at the bottom of your screen and tell us where you are listening from. It's always fun to see where people are coming from. Of course, Jackson here is based right here in Miami, but what's so great about the virtual opportunity is we can reach people literally all over the world. So I see Houston, Texas. That's awesome. Miami, Stephanie from Miami, welcome. We just love to see how far reaching that this opportunity is. And the great thing to know is that this will be available to you. We're recording tonight, so we will send it to you via email, and you can forward it to a friend or a spouse or a caregiver to share this great information. And I will say that there's also an archive filled with great resources, so you can check that out to follow up on things that we've done in the past, as well as prepare for some exciting topics we have for the future. I'd also love to know if this is your first time watching in, tell us. We want to give you a warm welcome. And always, we want these to serve you. So if you have any topic ideas that you'd be really interested to learn more about, we love feedback from our audience. So you can share those in that chat feature as well. And we'll take note of that. So a lot of these topics that we bring to you are from you, our community, who have the idea. And so we gather the expert, and we're just excited to bring you a wonderful resource tonight. So I'm watching our clock, and I want to get started so that we can learn from our expert. My name is Sierra Bragan, and I am your host tonight. I'm so excited to be here. I am the owner and founder of Miami Mom Collective, and we are Miami's premier parenting and motherhood resource, as well as community. We host events for moms and families, and we also produce high quality resources on our website, and then also through amazing events like this and partnerships with awesome brands like UHealth Jackson Children's Care. So we're excited. I believe we're going on three and a half years of partnering on this parental guidance series. So again, we have an archive full of all the previous episodes that you can go back and check out. But tonight we are talking about ear infections. And I was thinking earlier, you know what? I have the mascot for this talk because I've got a daughter right now with a double ear infection. So Dr. Torres, I'm coming for you with all my questions, but we're excited tonight to learn from you. Before we do, I'd love to tell you a few things about UHealth Jackson Children's Care, some things that you may or may not be aware of. But the UHealth Jackson Children's Care offers exceptional pediatric care throughout South Florida. And it's the only pediatric program in the region affiliated with an academic medical center. And it includes children-only emergency rooms, walk-in urgent care centers, pediatric specialty practices in Miami-Dade and Broward, and the Holtz Children's Hospital, which is one of the largest children's hospitals in the Southeast United States. And what's awesome about Holtz is that the pediatric emergency rooms there, as well as Jackson North, Jackson South, and Jackson West, are available 24 hours a day. And they're all staffed with board-certified pediatric emergency medicine specialists. So you're getting UHealth Miami system, and the pediatric emergency rooms, the children are usually seen within 15 minutes, which is just unheard of. So keep that on your radar if you ever need an emergency room. And the Holtz is 24-hour kids only emergency room, which is a great thing to know if you ever need that. The doctors and nurses are trained in pediatric advanced life support. And something that's new here in this last year is the urgent care centers for UHealth Jackson have partnered with UMNSU CARD, which is the University of Miami Nova Southeastern Center for Autism and Related Disabilities. And they have achieved the first autism-friendly designation in Florida. So that means that staff at all the urgent care locations are specifically trained, and that every center has a specially designated sensory-friendly exam room. So children of all wonderful abilities have the space that they need to get the health care that they deserve in a safe and controlled environment. So bravo to UHealth Jackson Children's Care for that. And we're excited to have one of our experts here tonight, Dr. Leonardo Torres. Welcome. We're so happy you're here.
Thank you. Thank you for having me.
Yes. I'd love to tell our audience a little bit about you. So Dr. Torres completed his undergraduate degree from the University of Arizona, where he graduated with honors. and he proceeded to obtain his medical degree at the University of Puerto Rico Medical School there, graduating at the top of his class. And he later continued his surgical internship and his, I'm going to see if I can say this correctly, so you'll have to correct me if I'm wrong, but otolaryngology. I
That
was
sounds
close.
that was very good.
Close. See, I can't even pronounce it, but you graduated with honors. So the head and neck surgery training he also did in Puerto Rico. And during his fellowship, he was awarded the A. Todd Davis Award for his collaborative performance during his training. So such an award has only been given to a surgical specialist twice in the existence. So that's amazing. Dr. Torres, congratulations. That's incredible. So he has a certification in pediatric otolaryngology. Still learning how to say it. From the American Academy, and his experience has ranged from newborns to young adults. So I'm thinking we're talking ear, nose, and throat. Is that right?
Correct.
Awesome. Okay, so we can handle that. His practice focuses on issues involving ears, such as hearing loss, recurring ear infections, nasal problems, including chronic sinus problems, nasal obstruction that would be due to complex airway problems, and congenital neck masses. So he's also actively involved in the teaching of pediatrics, the residents there at the University of Miami and the Jackson Memorial Hospital. So I don't know how you have time to teach others when you're doing so much yourself, but I love that you are, because you're passing that knowledge forward, and that's the way it should be. So Dr. Torres, thank you for joining us tonight.
Thank you so much for having me, and I'm excited to be talking to all the members in the chat, and hopefully transfer some of the knowledge and some of the information regarding this very important topic.
Absolutely. Well, on that note, those of you who are listening in, that chat feature, feel free to chat there amongst yourselves. If you have a question for Dr. Torres anytime in our time tonight, please drop that in the Q&A feature. That's just helpful for me to kind of see all the questions there, but I'm going to do my very best to get all those questions in front of him. So just put them there in the Q&A feature. But we'll start out by saying, if there are any parents or caregivers in the audience, which I assume there are, we're probably all maybe at least a little bit familiar with ear infections, because we've probably been there, but maybe not everyone. Can you just talk to us about why are ear infections so common?
That's a $1 million question, right? Why are our babies getting so many ear infections? And there are two main reasons. Number one, because their immune system, is still in development. They're still naive in the development of their fighting system against bacteria and ear infections in general. And also because their anatomical structures regarding the ear and the nose, it's just different than adults. And those two things predispose them to having more ear infections. People might think my kid is having so many ear infections, but the reality is that the problem is fairly common. About, most children by the age of 3 years of age will have at least one episode of ear infection. And, by the age of 5 to 6 years of age, at least 40% of kids will be having at least 3 ear infections in their lifetime.
Yeah.
So it's not that your kid is different. It's a fairly common situation, a fairly common problem for kids to have.
Yeah, that's right. I think a lot of us here are like, my kids are in that 40% of had
Okay.
3 or more for sure. So we're the lucky ones. So here's a question already from our audience. I love the participation. You mentioned just, the anatomical of how a child's ear is not quite as grown yet as an adult's ear. But this question from our audience says, when does the ear canal develop enough so that it's easier for a child to drain the fluids in their ears and potentially reduce those numbers of infection?
That's a great question. And I think when we talk about the word canal, we're talking mostly about a particular tube that we have within our ear structure called the eustachian tube. So the ear is actually divided in 3 different sections. And when we talk about ear infections, in general, we're talking about infections that occur in a space called the middle ear. And we call that otitis media, or inflammation of the middle ear. And within the middle ear, there's a very particular tube or a canal called the eustachian tube. And the eustachian tube connects that cavity, the middle ear, to the back of a nose. So when we're babies, or when we are, in development, that tube tends to sit a little bit more horizontal than when
Yeah.
we're adults. That
Right.
positioning also makes it more prone for getting ear infections. In addition to that, the pressure regulation, that tube is in charge of regulating how the ear gets air pressure in and out and so forth. That pressure regulation is actually a little bit out. It is known that most kids by the time they start in their early elementary school, they sort of outgrow that issue of eustachian tube dysfunction or problems related to the eustachian tubes.
Yeah. Okay. That's helpful. That would be my next question too. Are all ear infections the same, or are there varying kinds and degrees?
Yeah. So again, the terminology of ear infection can stem from either having a ear infection on the most external part of the ear, which we call, which are related to the ear canal itself and the skin surrounding the ear canal. And we call that an otitis externa. Those are the famous swimmer's ears that we tend to hear quite a bit, right? Because most kids, and when we talk about the prevalence of ear infections, we typically refer to the infectious process that occurs in that central cavity called the middle ear. Even within the infections of the middle ear, we kind of separate them a little bit because you can have what is called an acute otitis media, which is when you have just an infection in that middle part for an acute period of time, and that cavity gets filled with fluid that gets infected and it gets trapped within the eardrum cavity. It creates pain and earaches, and sometimes the kids can have fever. Sometimes that acute episode kind of goes away, but that water or that fluid that stays that was there while you had the ear infection kind of
Right.
remains in there for a little bit. We switch that terminology to like water in the ear or fluid in the ears. And in
Mm,
the doctor's world, we call it otitis media with effusion or a fluid in the middle ear.
mm.
And
Okay.
sometimes it is expected for some fluid to remain after an ear infection. In fact, up to 40% of kids after a month will have some degree of fluid in the ears related to their ear infection.
And that's after it being treated. Sorry to interrupt you. Like
No,
you
no,
finish the antibiotic, but like the fluid can stay.
exactly. And
Interesting.
if it stays for for an acceptable amount of time, it's okay. That's
Yeah.
how it should be. Unfortunately, there is a third entity called a chronic middle ear effusion or
Mm,
chronic water in the ears, in which that fluid has been there for a while. And
mm.
that's kind of a different sort of issue because that fluid can either get reinfected or create another set of issues.
Okay. Wow. My wheels are turning because my daughter, who currently has a double ear infection, who's finished the antibiotic, I'm like, no, why is she still like coughing? And some part of me wonders, is she still having some issues? But that's interesting when you put it all like that. I've never heard it explained like that. Talk to us about signs of an ear infection and how you would know, is it just going to go away or like it needs to have antibiotics?
Of course. So, depending on the age of the child, symptoms can be very different, right? So, they can be pulling or tugging in the ears. They might be able to tell you, Mommy, my ear hurts. Daddy, my ear is hurting. Mommy, I cannot hear very well, or something is bothering inside my head. Sometimes
Mhm.
they complain of headaches. But, in other occasions, it's just that crying, that irritability, that difficulty for them to like either fall asleep or stay asleep. They
Mhm.
can develop fevers of unknown origin. Like, where is this coming on? Like,
Yeah.
my kid was completely okay, and now it's having really having fevers for no reason whatsoever. And in kids that are walking, sometimes you start noticing that something is kind of a little bit off with their balance.
Mm.
Or if they're in the age of developing or talking or watching TV, you notice that they might be putting the TV a little bit louder or like not, responding to you when you call them as often. Some signs and symptoms are, of course, a little bit more worrisome. A very high fever is something that you want to, take particular attention to. Severe pain, a kid that is just screaming because they're in very, very uncomfortable pain. Or
Yeah.
if the kid starts draining from the ear, either blood or some pus, you definitely want to take that into a very strong consideration to escalate the treatment.
Yeah, that's good. I know it was a whole new parenting game when my kids reached the age where they could tell you what hurt,
Right.
like, oh, my ear hurts. It was like, okay, ear
Yeah.
infection. When they're little, you're like, oh, fever. Oh, are they fussy? So it's always good to check with your pediatrician just to make sure. But yeah, when they're able to articulate, that is super helpful.
Absolutely.
Um, what about this is a question that came from our audience, but are most ear infections the result of a prolonged upper respiratory infection? Or like if you have a cold, are you more susceptible to getting ear infections?
So most of them start with some degree of congestion, something that kind of happened at the level of the nose that translocated or got those ears infected. So yes, there's usually some relationship between the nose and the ear at some particular time. In most occasions, parents feel like, is my kid going to school with another kid that has an ear infection? Are they gonna get sick? And are they gonna get infected because another kid is is having an ear infection? And the reality is that it's really not the ear infection that can be contagious. It's what led into the ear infection. Really, that fluid inside the ear is not going to get your kid infected. However, the upper respiratory tract infection, the viral thing, the sinus thing that kind of happened in the development of that ear infection is really what's the contagious part
Yeah.
of the ear infection. And we saw that during COVID, right? When we
Yeah.
were a little bit isolated, we definitely saw a decreased trend in episodes of an acute otitis media or acute ear infection, simply
Makes
because
sense.
that kind of relationship or that contact with each other was a little bit more limited.
That's good. That makes sense. Absolutely. What about does flying at all have an effect on babies' ears? Like flying on an
Well,
airplane?
right. So baby's ears, again, going back to that eustachian tube, to that tube that regulates pressure, can be a little bit bothersome when there's a sudden pressure change inside the cabin, right? So when the cabin pressure increases, that eardrum, if it's unable to release that pressure, can get kind of sucked in, and
Mm,
that can create significant pain.
mm,
And there are certain things that we can obviously do to alleviate that discomfort that they might have in a
mhm,
very young kid. You can give them a pacifier or give them a bottle. In older kids, you can ask them to chew gum, or you can teach them
mhm,
how to kind of forcefully put pressure or regulate the pressure by doing something called a salva maneuver, which is that you kind of pinch your nose, you close your mouth, blow real hard, and you kind of try and regulate that pressure in there. But usually that's not necessarily an ear infection. However, a kid that has kind of the residue, that fluid from an ear infection, will certainly have a little bit more discomfort,
mm.
dealing with that pressure regulation with the airplanes.
That's good. Thank you. I'd always wondered. I'm like, I wonder, is there like, can the pressure
Mhm.
create an ear
We
infection? But
we all have been in an airplane when it takes off and you see that
it's not
kid in
fun.
the back or in the front just screaming. And I
Yeah,
feel for them because I know what's going on. I know what's
that's right.
going
As a
on.
doctor, you're like, it's their inner ear, middle
Yeah,
ear.
exactly, exactly.
That's, yeah. Okay, here's a question from our audience, a little specific. So
Mhm.
answer what you will or direct
Mhm.
us to our pediatrician.
Sure.
But this mom says her 15-month-old son has been on 5 different antibiotics since February with
Mhm.
5 ear infections. He's scheduled to get tubes. However, her big concern, both now and until his surgery, is what impact the frequency of antibiotics has on his system. Will the antibiotics not work for him in the future? Does this impact his gut health? Kind of what are
Mhm.
some things to take into consideration?
Oh, that's a very specific question, and certainly a very worrisome mom that is asking that question.
Yeah.
I guess my main concern will be, the appropriateness of the selection of the antibiotics. We, from the acute ear infection standpoint, we sort of follow a guideline, like a step of ladder on kind of the antibiotics that we want to use, and see how the baby's response to those antibiotics. Certainly, 5 episodes since February seems a little bit too much. And of course, my high suspicion is that there's still some of that fluid that we were talking about lingering in that ear. and placing the ear tubes is definitely, kind of gonna help. There's some preventive measures that we sometimes recommend parents to kind of help with those ear infections, and I think in here that, that's where it comes into play. You want to try and avoid, sickness, washing hands, if possible, minimizing exposure to other people that might be sick, including daycare, avoiding people that might be smoking, because that can definitely affect the middle ear. And feeding your baby, or giving a bottle when they're in bed. Those are some of the things that, sometimes we can do. Unfortunately, there's no magic thing that we can say, okay, from now on until surgery, she's not going to get an infection. It just, it's a little bit harder than that to control.
Yeah. No, thank you. Thank you. Okay, you mentioned earlier about, symptoms with like the hearing, like, oh, they turn the TV up loud or they don't respond when you call. One mom asked, are the symptoms regarding hearing long lasting, or do those typically go away?
So that's a very common question and a very, very important concern, because even though we're talking about ear infections, one of the consequences from having that fluid that is not actively infected, that bacteria went away.
Yeah.
When you kill it with the antibiotic, that fluid that lingers does create a little bit of a hearing loss, and we call that a conductive hearing loss. Basically, all that means is that that water or that fluid that is stuck inside your ear does not allow the transmission of sound as we normally do. The ear is designed in a way so that the airwaves can travel easier through air than through fluid. So when there's fluid, then that sound wave doesn't get transmitted. That conduction of the little structures inside the middle ear don't work as they should. And then we create what is called a conductive hearing loss. Thankfully, most kids, number one, the fluid goes away on their own. So we don't have to be doing a lot of surgery unnecessarily. But number two, that once that fluid is gone, or once it's taken out by a surgeon, then we can reverse the degree of hearing loss that they're having. Of course, this plays a very important role when you have a child in speech development years, right? In a kid that is, developing speech, and you're trying to make them catch up and so forth. That little bit of hearing loss, some people say, oh, it's just a little bit. Yeah, but that little bit has an impact, unfortunately. And sometimes it can create some lags in the development of speech.
Wow. Yeah. I think that's an important thing we tend to forget. We kind of think isolated ear infection, it just hurts your ear. But like all of those things, especially with our little developing ones, like all the things that it can be, interfacing with, that could cause more trouble as well. So thank you for speaking to that. That's important. Okay, here's a couple more questions from our audience. We've got some great questions. One asks, is it best to avoid the pool, the sea, the shower, the bath when you have an ear infection?
So, so the pool is that one that we always get, that most ENTs will get when we're talking about an ear infection. And certainly the pool can induce a swimmer's ear, right? That's the concept of a swimmer's ear, which is that infection that we were talking earlier from the outside of the ear, correct. Okay. However, when we put our kids, when I put my daughters on the pool, many times they come out of the pool and they're stuffy and congested in the nose, and they can develop a little bit of a transitory congestion in the nose. And that's really what could affect the otitis media, like the episodes of the middle ear. There's no true consensus that you need to avoid the swimming while you have an ear infection. However, it is it will be common sense that if the pool or whatever activity you're doing will lead into some degree of nasal congestion, to try and avoid it until they feel better.
That's good. That's good. I know my mom's always said, keep those babies out of the water. And I'm like, do I really need to?
And some people think like, oh, the water that they have in the ear came from the pool. I'm like, no, it didn't come from the pool. Like,
you heard it here, folks.
It's not that you have
Didn't get in. And
some,
I guess, and that's a common misconception. I mean, I've even thought too, like, oh, you're swimming a lot. Swimmer's ear means, because we've all felt that, like, oh, I gotta, shake it out. Does that mean
exactly.
that fluid stayed in and then it got bacteria and then you got an ear infection?
Yeah, if you get very congested in your nose, from the water activity that you're doing, certainly the ear is going to have a harder time trying to get rid of those. But the
Mhm.
target should be the degree of congestion that you can have within the nose.
Okay, that's good. Yeah, because the nose and the ears are
Correct.
connected, related. Ear, nose, and throat, that great big huge word that I haven't
Exactly.
learned yet, but that's great. Well, and this is something that surprised me. I'll say I didn't realize that adults could get ear infections. I had one, about a year ago, and I thought, wait a minute, adults can get ear infections. So why are children more so prone than adults?
So number one, because of their immune system, as we were talking earlier, right? They still need that exposure to things, or to those pathogens that lead into the ear infection. Secondary, because of that tube that you stick into plays a very, very important role in the drainage and the kind of the door for the bacteria of the nose to go into the ear. Those are like the primary two reasons why we want to address and attack the nose as much as possible. Also, kids have a tissue inside their nose called the adenoids. And the adenoids is part of our kind of has tissue that is part of our immune system. And that it almost acts as a sensor. It detects
Mhm.
something strange and it creates a little target for our body to know that this is something strange. Unfortunately, sometimes adenoids can get inflamed and or infected, and that chronic inflammation and that chronic infection can lead into that kind of bacteria being there inside the nose and making you more predisposed to getting more ear infections.
Wow. So is that when people have like their tonsils and I know it's like all taken out? Is that help? Is that kind of another means of helping reduce?
So usually when we talk about ear infections, we wouldn't address the tonsils at the
Yeah.
same time. The reality is that tonsils are, surgically addressed for other reasons. However, if there is the current guidelines, what they say is that if you have a child that has recurrent ear infections and you think that they might benefit because they meet the criteria for putting those little tubes that one of our uh, listeners or we're talking about,
Yeah.
if you find a reason that the adenoids is also a factor to the development of those ear infections, then they can be addressed at the same time. Also, in older kids that have that fluid never go away, you
Mm.
sometimes address the adenoids. You take them out to kind of clear the pathway so that in the future they don't develop the same issue over again.
Interesting. Wow. Wow. There's so much that goes into it. Goodness. Yeah. You think as a parent, like, oh, I kind of had my share of ear infections. We pretty much know, but man, there's a whole lot there. We're
Absolutely.
getting some great questions from our audience. And so now I want to ask you a little bit about preventative measures, but also maybe some remedies. Or are there things to try at home? So I've got a couple questions here. One says, I heard that putting a drop of alcohol in the ear to help with water in the swimmer's ear. Is this a good thing that works for outer ear infections?
Well, the famous swimmer's eardrops, that we can all buy like at pharmacies. I'm not going to say any
Right.
names, but like
Over the counter or something.
over the
Yeah.
counter drugstores. They're usually a combination of like a little bit of alcohol with a little bit of vinegar or like acetic acid. And the idea is to kind of dry any remnant of dry out the ear canal a little bit. But it's important that we recognize that this, the intention for this is really to address the outer aspect of the ear
Mm.
canal, nothing that is passing, going on past the eardrum or inside the eardrum. Most importantly, if you have a child that either has or has had a perforation in the eardrum, meaning a hole in
Mm.
the eardrum because maybe one of the ear infections got a little bit too out of control and they
Yeah.
drained some pus, or they had tubes, or any kind of complication in which there is a hole in the eardrum, that is going to be extremely uncomfortable for them to
Mm.
take. It's going to
Yeah.
be painful for them to
Wow.
have those type of drops instilled
Yeah.
into the ear canal.
Mm. On that note about the eardrum, I've had a child who had such a bad ear infection that it burst. And that,
Mhm.
oh, sounds terrible. And you're saying like the whole, like, does it over time heal itself, like grow back together? Is there always a
Yeah.
puncture there?
Mo
I don't know.
Thankfully, most of the time, yes,
Yeah.
because we don't want to be fixing eardrums all the time. But
Yeah.
thankfully, most of the time, when there's a spontaneous eardrum perforation, it will heal on its
Wow.
own if you allow them, to have adequate time to heal. And basically, the ear is saying, "I can't deal with so much pressure. I
Yeah.
need to get this out,"
Yeah.
and then the ear will drain out.
Wow.
And that's the concept of those little tubes that the listener was talking about. We By placing tubes, you create like a control hole for a
Mm-hmm.
temporary time, so that if the kid gets another ear infection, the ear infection has a clear
Just drain.
pathway to drain out. Correct.
Wow.
It also allows you to have a window, right? Because now you have
Mm-hmm.
a control hole through which, if you need antibiotics, well, maybe we can choose an antibiotic in a drop form instead of like a oral,
Like oral. Okay.
systemic form.
Wow. Dr. Torres, I understand why you're also teaching others. You're an
Mhm.
exceptional teacher. I feel like I've sat with doctors before who no doubt are
Uh,
very skilled in their practice, but communicating and teaching others maybe isn't the strong suit, but you have just been outstanding in terms of
you're too
teaching us
kind.
all this
You're
information. I wish you had a little like ear poster so you could point out all the ear
I
anatomy
just
for
thought
us.
about that as I was telling you. How do I explain this on a camera? Yeah, I
No,
thought
you're doing
maybe I
great.
should
You're
have
doing
a.
great. On the note of, kind of home remedies, another mom says, how effective or do you recommend garlic oil? I've heard about garlic oil. If your little one starts having discomfort, and also are there homeopathic ear drops to use after being in the pool? What do you suggest?
Yeah. So, that's an area of a lot of debate. And the debate stems from, number one, efficacy, but most importantly, safety.
Yeah.
So from the over-the-counter medications, like we all have seen in the aisle ear drops for pain, and
Hmm.
they come from the concept of homeopathic medicine, and they have different type of compounds that in on and off have been shown to have some benefit regarding pain. The problem is that there's no real good standardized studies to support and generalize the recommendation for them. That's
Gotcha.
number one. Number two, if we don't know the status of that eardrum, if we don't know whether or not that eardrum is completely closed, then we
Hmm.
can be instilling garlic and or something else inside that cavity of the ear, which is not prepared
Right.
to receive those sort of medications.
Yeah.
Um, there is, recommendations in regards to pain control, because that's the number one issue with a mom and a dad that is desperate, right,
Right.
to get a, their kid better, to get them alleviated. And we often recommend acetaminophen, ibuprofen, and or a combination of both to alleviate them. And sometimes it is reasonable to have a watchful period of time before
Hmm.
starting any aggressive treatment. Depends on many factors.
Right, of course. Yeah. And always good to ask your pediatrician.
Yeah, exactly.
Great and helpful. Okay, this is an interesting question, and I've wondered the same thing. But one of our attendees asks, does earwax have anything to do with infections? Or like, sometimes I can see visible earwax in my
Right.
children's ears, and I think, is that something to be
So,
alarmed?
so wax could be an enemy for diagnosing a true ear infection. And what I mean by that is, if your child has a lot of wax and it's difficult or nearly impossible to see the eardrum, then we might not be able to make the complete assessment of that
Mm.
eardrum, whether or not it's sticking out, whether or not there's fluid, and whether or not that fluid might be looking either like it's been there for a while, or it's something like more recent that looks really infected. So it is customary, at least in the ear, nose, and throat world, to try and clean the ear to the extent that we can to see that tympanic membrane and assess mobility and assess whether or not it's bulging and so forth. Wax does have like a protective kind of property for those outer ear infections that we were talking about, right? So we don't want to leave the skin without any protection whatsoever. And most importantly, we don't want to be creating any kind of little tears on the skin around the canal, leading to making the kids more prone to outer ear infections.
That was my next question, is like, do you recommend, should we be like Q-tipping our kids' ears, or should we stay away from that?
No Q-tips. No. So my grandma used to say, you only clean your ears with the elbows, because if you try, you won't, right?
That's right.
So, and that's, that's really the concept. The ears are not designed to receive Q-tips. In fact, if you read those little boxes, they say, please do not insert into the ear canal. And there's a reason for that, right? The ear canal is about, a centimeter, a little bit over a centimeter, depending on age. And sometimes we enjoy the feeling of the Q-tip, but we go a little bit too deep and we can injure the tympanic membrane. Most importantly, in many occasions, we're just pushing the wax, but we're not taking out the wax, which makes the job of either the primary care doctor or the specialist a little bit harder.
Okay. Yeah. Wow. Good point. You're kind of blowing my mind, because I didn't know we should never use Q-tips. Never read the box.
I'm sure it feels good, but it's not a good idea.
There you go. There you have it, folks. You've heard it here. Okay, a couple more audience questions. One is it possible, you're talking about tubes, to get tubes and then continue to have ear infections, and why or why not?
Yeah. So the tubes are not designed to be a stop for the ear infections. They certainly control the ear infections, primarily because of the ability to drain out or ventilate that cavity, that middle ear cavity, which develops the fluid and acts as a rest, like a pool for bacteria to grow inside that fluid. So certainly opening that window and releasing that fluid will definitely help, but there's still the possibility of getting an ear infection. However, the treatment changes a lot, because if your child only has just an ear infection with drainage, a reasonable approach is to try eardrops with antibiotics and try and avoid the use of oral antibiotics unless they don't get better, or there's any other associated sinus or lung or anything else that might be affected at the same time.
That's good. That's great. Okay, here's one. You were talking earlier about, obviously, the congestion is really one of the biggest reasons why we get the ear infections, and we've got to do all we can to guard against that. One mom asked about suctioning and how much is too much, and is it true that it can actually cause more congestion? So is it counterintuitive to do the suction? And I've heard the same thing, like, when do I suction? When do I do saline? Like, it seems, what do I do?
Yeah. So keeping the nose as decongested or as clean as possible is obviously going to be, a good way to hopefully not translocate bacteria from here to the ears. As far as suctioning goes, there's a zillion different devices, a whole bunch of ways of suctioning the nose. I often recommend, when the kid is relatively small, if you can suction traumatically, meaning not creating a lot of resistance and a difficulty putting the suckers in. I'm trying to avoid using any brands, but any suckers or anything inside the nose, then that's a reasonable approach. However, as the kids get older, I sometimes recommend just plain saline, either spray or a mister, just to keep the mucus flowing, to help with the flow of mucus. Because sometimes, as that listener is saying, the control of the kid and the trauma of putting things inside the nose can make the kid more congested.
Yeah, that's good. That's helpful.
Or a nosebleed, of course,
and you don't want that. Nobody wants that.
Yeah, exactly.
Here's another audience question, and forgive me, I don't know if I'm pronouncing the words right. I'm not the doctor here. But this person said, could there be tinnitus issues in children? And if so, how do you diagnose and treat?
Oh my goodness, that's a very, very good question. Uh, so tinnitus can exist in children. It is different than adults because many kids are not aware that they shouldn't be hearing that. So to summarize it for the listeners that
Tell us
don't.
what it is for those who
Exactly.
don't
That I
know.
think that's the number one step. So tinnitus is a ringing noise inside the ear, and it can
Mm,
be either one side, two sides, and so forth.
interesting.
Wax can create sometimes tinnitus. Fluid can create tinnitus. There's many causes for tinnitus. Even hearing loss can create
Wow.
tinnitus. But in children can have it, and we should pay attention to any complaint from a child that is saying, "Hey, I'm hearing kind of strange noises inside my ear," and so forth. Um, Obviously, in the era that we're living, noise induce issues, right? The degree of the noise exposure that sometimes our kids are exposed can have long-lasting consequences, and including hearing loss. And
Mm,
that's one of the causes for having ringing in the ears. So more than ear infections, I will be paying close attention to the degree of noises surrounding our
wow.
kids.
That's good. It makes me wonder too nowadays with all the little, when I was a kid, we
Earbuds?
didn't have all the like earbuds
Yeah.
go right in, right up against you.
Yeah.
Um, Interesting.
But if we think about it, in school, our kids are surrounded with like Chromebooks and like the tablets and all
Yeah.
this sort of devices, and they're hooked on headphones all the time to do their schoolwork. But I think it's our responsibility to, at least at home, monitor the degree of volume levels that they have
Yeah.
to make sure that they're acceptable. And there's some devices that allow you to monitor the not only the screen time, but also volume levels and so forth.
That's great. That's great. Here's another question on that note, and very interesting. So, for our community who may have special needs children or children who are nonverbal, how do you determine if there's ringing in the ear? Is that like anatomical? Can you like see that in
Yeah.
an exam or?
So, I mean, this goes to a different level of medical terminology, but there's two types of ringing. Sometimes there's ringing that only the patient can perceive. Sometimes there's ringing that, other people can perceive. Kids with special needs, it is obviously important to make sure that they're hearing correctly, right? To make sure that there's no degree of hearing loss. As far as an objective way of just saying whether or not somebody has tinnitus without the patient expressing it, unless is objective tinnitus, unless somebody else can hear it, it's just very difficult to get it, to
Mm,
know it.
yeah. Oh, well, great question. The audience is doing great with
Yeah,
questions
a
for you
lot of
tonight,
questions.
Dr. Torres. They're
I'm
keeping you on your
surprised as to
toes.
how many. Yeah.
They're keeping you on your toes. Okay, we talked about antibiotics and like when an ear infection requires antibiotics. Is it pretty much like if there's an infection, it's going to need antibiotics, or how do you know when it requires? And then the
Yeah.
different treatment options. I know you talked about drops versus oral.
So there's a lot of factors involved. It might just seem like ear infection antibiotics, but the thought process is actually a little bit more complex, both at the primary care level, at the pediatrician's level, and also at the specialist level, right? Because when they come to me, they have tried other things and so forth. So at the primary level, you have to, first of all, know the age of the patient. If it's a child under 6 months of age, you definitely want to be more receptive to taking that antibiotics. It's a very young kid. Complications from an ear infection can be a little bit more serious. So you definitely want to do it, be receptive to using those antibiotics. From 6 months to 2 years, there has to be a conversation between the primary care doctors and their patients' parents regarding how receptive they are to either do a period of watchful waiting or just starting antibiotics. And
Mhm.
sometimes it will be reasonable to give 24, 48 hours as a watchful period of time, maybe give a little bit of pain medication, like we were talking earlier, acetaminophen, ibuprofen, and see how the kids react. The problem with that is that it does require a reassessment. You want to make sure that they're doing better. You don't want to just
Mhm.
leave them hanging.
Yeah.
And after 2 years, again, it's sort of the similar approach. Between 6 months and 2 years, if it's one-sided ear, then we can do, we feel a little bit more comfortable doing the watchful period of time. If it's both ears affected, you want to be a little bit more receptive to taking the antibiotics. And when I give these sort of guidelines, I talk in general terms. You have to take into consideration any other medical aspect that the kids might have. We have kids that have seizures because they have fevers. So in those kids, that watchful period of time, maybe not such a good idea.
Right, right.
Kid that has a clefted lip or a clefted palate or any other, comorbidity or any other medical condition that you might want to just get them off that pathway and just go straight for the antibiotic course.
Yeah. It's not a one size fits all kind of solution. I see.
Exactly. Even though it seems like, oh, it's just an ear infection antibiotic. No, it's there's a little bit more of a thought process in regards to that.
And interesting to know, I mean, from my experience, correct me if I'm wrong, but our pediatrician sometimes said, let's start her on this antibiotic. And if that, then we kind of to try to be conservative of different,
Yeah.
I guess, varying degrees of strength.
Exactly.
So
we look at, when was the last time they had an antibiotic? Which type of antibiotics were they the last time? Are they in school? Do they have a sibling that is also prone to ear infection? Are you in a geographical area that the bacteria tends to be a little bit more kind of resistant? There's a lot of factors in regards to that, but certainly doing like a step up manner, like increasing the density of the antibiotic is certainly the reasonable approach.
On that note, this is an interesting question that we received. Say an antibiotic, is prescribed to a child. Is it ever common for okay, it resolves in one ear, but not in the other? And what would you do in that case?
Yeah. So again, that the question there, it's a little bit complex in the sense, did it resolve just the ear infection or did it resolve both the ear infections and the fluid? Because sometimes what could happen is that you have a ear infection in both sides. You treat it with antibiotics. Now the infection is gone in both sides, but you have some fluid remaining on one ear. You can have the situation in which the infection didn't resolve on one of the ears, at which time you might want to step it up to a different level of antibiotics. So it's very important to make that distinction. Is it a recurrent or a persistent ear infection that didn't get better? Or is the infection now under control, but all we have is that fluid still there?
And that's what you're saying earlier. If that fluid stays, it can create another one. Is that correct?
Well, it's basically the environment, the proper environment for another infection to develop if bacteria travels again inside the ear. And one of the reasons why we sometimes put tubes is to get rid of that, empty that hole, right? Just don't have that environment for the infections to develop.
That's great. Dr. Torres, this has been incredibly informative. To those guests who are listening, I did want to remind you that these will be recorded and they'll be available for viewing later at parentalguidance.org. So if you want to forward it on to a friend or someone, just know that that's going to be available resource for you. So a few more questions. I'm watching our clock here, so we finish right up at 9 or a little before. But okay, how long will it take before a child gets better after an ear infection? When should you start seeing man, they look better? Or if they're on a 10-day antibiotic and day 9, they still seem like they're struggling.
Yeah. So that proper reassessment is certainly very important. You want to make sure that you're on the track of recovery. Usually, 48, 72 hours, you definitely
quickly,
should see some improvement in some of the symptoms, not necessarily all the symptoms, but the fevers and so forth. The more acute sort of symptoms should be getting better, not necessarily completely resolved, but definitely better. And if not, a reconsideration on that, increasing in medical management or intensity of medical management should definitely evolve. As far as the fluid itself, it can take up to 12 weeks for fluid in the ears to completely go away. It's thankfully, more than 40% within a month, they will have their fluid completely gone. But yeah, there depends on what we're talking. What symptom are we talking? The most intense symptoms, you should see some alleviation of symptoms fairly quickly. I mean, 72 hours is a long time for a parent that is desperate for the kid to
Yeah.
get better.
Yeah.
But definitely some other issues like the fluid can take a lot longer to resolve.
Yeah. Wow, so helpful. What about similarly, what about following tubes? I know I've got one baby who had tubes and it was like
Mhm.
he was another baby the next day,
Yeah.
like he just had relief. But how long does that process take of healing?
So basically, we put tubes only on very specific babies, and that's very important for our listeners to understand. We under no circumstance I want to recommend that you talk to your pediatrician. I want the tubes. I want the tubes. No, it doesn't work that way.
Yeah.
And there's some criteria that we use. In general terms, we want to be able to have documented at least 3 ear infections within the last 6 months or
Okay.
4 infections within the last 12 months. And those either 3 or 4 or even more will
Yeah.
need to be have completed treatment
Yeah.
with a proper treatment.
Right.
Also, at the time that the ENT or the specialist sees the baby, they want to be able to and know that there is presence of fluid because that's our telltale sign. Yes, this has been kind of a chronic issue, like a
Persistent. Yeah.
long-standing issue that they're getting frequent ear infections. The surgery itself, it's a relatively straightforward procedure. Unfortunately, in most situations, it does require some anesthesia, but the surgery tends to be relatively quick. Most surgeons within 10 to 15 minutes are able to place both tubes. The kids are able to go home the same day. And I always tell the parents the day after the tubes, everything goes back to normal. Okay. Whatever you were doing the day before the tubes, the day after the tubes, you continue doing. Oh,
Okay.
can they go to daycare? Yes. Can they go swimming? Yes. Whatever you were doing, keep on doing so that you go back to your normal life as quickly as possible.
That's great. That's great. I love what you said that it's not just like, oh, elective, can I sign up for tubes? But
Yeah, yeah.
getting your
Unfortunately,
child.
the desperation, and I feel it. Trust me, I feel it with
Yeah.
my daughters
Yeah.
too. But the practice guidelines are created based on evidence, scientific evidence,
Yeah.
and we always take the risk versus the benefit in a balance. So
That's good.
certainly taking any patient, even if it's for tubes to an operating room, has to be taken very, very seriously, has to be taken very cautiously, so that we minimize any potential severe issues.
Yeah, that's great. That's good to hear. Okay, here's a question. On that note, like when should your doctor send your kid to an ENT, or when should you say, I think we want to like visit an ENT about this?
So certainly when that frequency of ear infection is what we're describing, 3 in 6 months, 4 within a year, those are typical cases in which they should be sending their kids. Also, if they treat an ear infection and they continue to follow the patient and the fluid, it's not going away, it's not going away, and 12 weeks pass and they're able to document that there's presence of fluid for over 12 weeks, certainly that's an issue.
Yeah.
Other patients that certainly benefit will include babies that have special needs, like we were talking earlier, Down syndrome babies, kids with cleft lip and palate, kids
Hmm.
that have uncontrollable seizures because of fevers and things like that. And most importantly, or not necessarily most importantly, but a big group is the kids that, they're not catching up on their speech,
Yeah.
that you want to maximize that hearing
Yeah,
so
that's
that
great.
they can catch up on their speech development.
I love that. Just a reminder to look at the whole child, not just this
Yeah,
one
yeah.
isolated part.
Because even though
Very
we have
well done.
checklists, this checklist can go from here to here. It can deviate very quickly based on specific situations.
Yeah, that's super helpful. Okay, what about after you have the tube surgery? When did the tubes fall out? How should you watch for them? Should
Oh,
you catch them? And does the fluid reappear when the tubes fall out? Kind of how does that work?
the tubes there's certainly different type of ear tubes. There are some tubes which are thankfully are the most common ones. They tend to be sort of short term, and when we talk about short term, they usually fall within 18 months of being in place. Sometimes as early as 6 months to 18 months or so. There are other shapes, other types that can be used in specific cases that can take a longer period of time. But for this conversation, we'll stick just to the simple kind of ear tubes. They should be followed. One of the important things about ear tubes is that after you place them, you want to make sure that that hearing is good, right? Because if you did them and they had fluid, and for whatever reason you're concerned about the speech or anything like that, it's a good idea to have kind of a hearing assessment. Ideally, we will also have a hearing assessment prior to the tubes to see how much impact that fluid or that frequency of ear infections might be having on the hearing. And then, I typically follow ear tubes around every 6 months just to make sure that they're behaving normally. In very rare circumstances, they can develop a little bit of scar tissue around them, or they can get clogged with some wax, or they simply popped out, but the kid has so much earwax that you just can't come out. So, in the office, we often just, grab them and just pull them out. But in most situations, parents are not even aware that they they fell on the pillow or swim in or something like that.
Okay. Yeah, that's helpful. Wow. Okay. Well, we're about to wrap up our time.
Okay.
So I think I maybe can squeeze in one or two more questions, but
No problem.
Talk to us. You talked about the surgical options to help with ear infections, obviously tubes. I mean, are there other things, or that's kind of the baseline of where you start for our conversation?
Yeah. So prevention, prevention is very, very important. And as we were talking earlier, parents should strongly consider breastfeeding when they have a newborn. They should have their kids vaccinated, good hygiene, making sure that, where your kid is being taken care of, has good overall hygiene. Try and steer away from sick people. People that are constantly sick and so forth, they're gonna most likely get your kid sick more often. Smoking, I can't stress how bad smoking is for a kid's nose. Even if it's far away, even no smoking close to my kids. And the use of bottle and pacifier, those things. So, prevention is very, very, very important. As far as management, when we talk about the antibiotics, the management of the pain, and so forth. After that, we jump into ear tubes and our consideration of other issues. Is my kid more susceptible to ear infections because their immune system is not right? Is there something off? But typically, when you have a patient like that, you will have other things. You have to look at the overall perspective. If it's only ear infection, it's unlikely that that's the case, right? And obviously, when we talk about controlling the congestion, either from smoking again, allergies, anything like that will create that congestion, have it under control so that we maximize how those ears are working.
That's great. Thank you. I think we'll end it with this, just because it gives us the encouragement to stay on top of these. But tell us a little bit about just the long-term, consequences of ear infections. I know you talked about hearing loss.
Yeah. So hearing loss and speech delay, that's my big thing, because we want those kids to have productive school life and development. Other rare issues is when that eardrum is under so much tension, sometimes, it starts behaving a little bit funky, get kind of sucked in and doesn't move as well as it should. Other complications can include the possibility of having the infection spread from the ear into the backbone, which is called a mastoid, and we call that a mastoiditis. In rare circumstances, that can lead into like a very bad infection, and you have to do like a little bit more of a complicated surgery. And in very, very, very rare circumstances, the ear is close to the brain. So sometimes we can unfortunately still have some complications in the brain. But overall, thankfully, my intention is not to scare anybody. Those are rare. From chronic ear infections, sometimes there's also called a cholesteatoma, which is a a little skin growth inside the ear that can kind of keep on growing and growing. And sometimes we have to do more extensive surgery to clear it out. But again, thankfully, all those things are relatively frequent.
Yeah. Wow. Dr. Torres, you are a wealth of information and you have
Oh,
delivered it so
you're
well
too kind.
tonight.
Too kind.
Thank you. This is great. You've taken a topic, that I'm like, nah, ear infections, but it's fascinating. And I've just learned so much. I thought having 4 kids with lots of ear infections made me a semi-expert, but not at all.
A lot of
Not at
parents are
all.
experts. They come with very good questions. They come very educated, and I certainly encourage everybody in the chat and the listeners to educate themselves.
That's right.
Because that's knowledge is power. So the
That's
more
right.
you know, and the more knowledge you have when you go to the doctor, the better.
That's right.
And the
Ask
more
the right
satisfied you're
question.
going to be.
That's right. Well, it's been a great audience participation tonight. You all came with wonderful questions. We're going to put a little slide up here on the screen. If you want to screenshot to do a little more research on your own, you can. Here's a couple of resources that Dr. Torres has provided. But otherwise, I want to tell you about our next parental guidance episode happening Thursday, June 15th. We're going to be talking about childhood obesity. So about 1 in 5 American children has obesity. That's a staggering statistic. Childhood obesity is a medical condition that affects children and adolescents and can put a child at risk for chronic medical conditions. So tune in to learn about the causes of obesity, strategies to reduce childhood obesity, as well as the treatments and surgical interventions that are available for adolescents with obesity. So that's going to be Thursday, June 15th. You'll get an email, but mark your calendars. And then again, the recordings of all of our parental guidance webinars, as well as downloadable tips and resources, can be found at the new website, which is www.parentalguidance.org. So you can also sign up there for any of the upcoming episodes, refer that website to a friend, and they can check out our archives. There is a ton of resources there at parentalguidance.org. But Dr. Torres, thank you again for your time. We appreciate you. Thank you so much. And
Thank you, everybody. Have a good night.
Absolutely. And all of our audience, thank you and have a wonderful evening. We'll see you next time.